is there's all these different implants have gone through. We've had multiple generations of implants. Is there a difference in the implants, and how do you choose an implant for a patient? I'd like each of the panelists to answer that.
Well, each implant functions a bit differently. You know, I don't want to go through all 6 of the implants at the moment, but I mean, the anatomy depends. So typically in the lower cervical spine, if the patient has a high angle slope on the standing x-rays, I'm getting a little technical here, but I want a disc that's going to resist shearing or sliding because there's that tendency. So I use more of a fixed core artificial disc that will allow and help resist shear to protect the joints and the nerves a bit better. And then as I go higher, I'll often pick a slightly more mobile core to provide the more functional mobility that the patient needs, and sometimes the compressible core as I get higher up as well. So each level kind of depends a lot on the anatomy, and selecting the proper device, I believe, optimizes outcomes, and placing them properly, as you mentioned, Tom, is so critical. It's much more difficult to place these things in the right positions, but knowing this, what we call the center of rotation, where the disc needs to be to allow the vertebrae to roll normally, is critical. And like with hip replacements, you know, there are doctors that do hip replacements, but then there are doctors that do the revision hip replacements, and they're different guys. And so I think we would classify ourselves as revision guys and initial implantation guys both, because we have that experience. So that field gets smaller if you've had a disc that's failing, on who's really going to be the expert for the patient to select at that time.
Tom, in my practice, I currently use 4 different discs. I've become very proficient at all of them. And I use Mobi-C, I use ProDisc-C, I use Simplify, and most recently I've been using M6. And I think along the way, as I heard my colleagues, I've heard Todd talk about some of the discs that he has used. I've talked to Rick, some of the discs that he has used, and also colleagues across the world. And, you know, what I can say that we don't have the perfect disc yet. We don't have a disc that is the absolute champion, the Olympic champion of discs, but I do think that we have some very, very good discs that used with proper indications in certain patients, given whatever the given pathology is, as well as a number of different other parameters regarding the alignment, etc. So what I try to do is, as a result of my experience, as well as a result of observing some of my colleagues use a variety of different discs in different environments, I feel like I've become fairly good in being able to choose the right disc for the right patient. And I think Todd alluded that a lot of patients will come to us having either been marketed to or having done some research and wanting a certain disc. And if that happens to be a good disc that is, fits them, fits their needs well, I have no problem providing that surgery to them. But if I believe that another disc is going to give them a better outcome, I will certainly explain to them and educate them as to why I believe that this other disc may be a better option for them, and then go on to have that surgery performed with a disc that I believe will give them that best outcome.
And we do use a variety of discs, and we try to custom fit each one to the patient. But on the other hand, just to bring us back down to earth, I have to quote one of our colleagues that says, it doesn't make any difference. Just learn one, do it well, perform the operation the best you can. And if you think about it, that's better than someone mastering or being a master of none. In other words, just choosing willy-nilly any different disc or the new disc that comes out. And I think his point was that whatever disc you use, just make sure, as Armin said, you know the ins and outs, you have perfected the technique, and you understand why you're using one over another one. And when you do use it, you're doing it the best that you can do.